Our business started in 2018.
Oh.
So both of us had come from the community pharmacy scene, behind the counter. Just being in that scene, we noticed that there was a gap in care. So we would have people come in, for instance, with a new prescription for diabetes. And, we go over and ask, do you have any questions? What was your A1C the last time you were in your doctor's office? And they're looking at you like you're speaking a different language. Dr. Jennifer and I have known each other over 20 years. And we talk periodically, and we're like, you know what? There's a gap in care. There's a need for more comprehensive, personalized care, and we're not providing it behind the counter, dispensing prescriptions as fast as we can. And so that's where the consulting came from. We want to be that bridge between the patient and their healthcare provider so that we can improve outcomes.
Have you heard the saying, the opposite of addiction is connection? We at the Addiction Prevention Coalition know that there's truth in that adage. And so we are fighting addiction face to face, conversation by conversation, creating connection. Here at The Shield, our new podcast, no topic is off limits because there are no limits when it comes to substance use disorder. Welcome to The Shield. This is where we sit down face to face, have an opportunity to talk about how mental health and substance use impacts all facets of life, and in the meantime, also highlight some really awesome things that are going on in Central Alabama. So we're on this kick lately where I don't choose guests. People just tell me who I got to have on. And this is another one from our fearless leader, Ronnie, our producer here. He is in a cohort. Well, he's in a lot of cohorts, but he's in a cohort with y'all. And he came back, I think the first day he met y'all, and he was like, you have to have them on. So without further ado, because I just do what Ronnie tells me to do these days, is Dr. Jennifer and Dr. Pauline. They are the co-founders of, get ready, y'all, MedsPLUS Consulting Pharmacy and Wellness Center.
You did great.
Woo! Well, because I took notes.
Best way to do it.
So welcome.
Thank you so much for having us.
Happy to be here.
So we're going to talk about kind of what MedsPLUS Consulting Pharmacy and Wellness Center is first, and then I want to get into the backstory about how you got here. But what is it for the layperson who's just hearing about y'all for the first time? What is it?
So for the layperson, we're pharmacists. So we do have a pharmacy where we can fill your prescriptions. We can actually deliver them to you. So we also do immunizations. We do diabetes education. We do genomic testing as well. So we have other services in addition to the retail pharmacy piece. The consulting that comes in with the healthcare consulting, so that means we will do workplace wellness with employers where we would come in and do screenings for the employees.
Flu or back in the day, COVID or whatever.
So for the screenings, what we'll do is take a look at your biometric. We'll do a biometric screening.
Oh, I see.
So we'll take your blood, take a look at your blood sugar, take a look at your cholesterol. We'll get your blood pressure as well as your weight, your BMI. And then we can let you know if you're at risk for chronic disease or if you have a chronic disease, how well you're managing that. So we'll do a consultation after we get the results from the screening. So what you're talking about, that would be like we would go on site to do immunizations for employees that sign up that want to do that. It could be flu, it could be COVID, it could be shingles. Also, it could be pneumonia because now it's recommended for age 50 and up. So, so we kind of have that where we are in the office and then we're also mobile. So we do a lot of community events. We talk at churches, organizations. We have a big push for senior centers for flu access as well because our seniors are most vulnerable.
Sure.
Because a lot of times they'll have other conditions that if they get the flu, they could possibly end up in the hospital. So we want to try to prevent that.
So, Dr. Pauline, I was going to ask, when you said, Dr. Jennifer, we're a pharmacy, I was going to ask, well, what makes you different from a CVS, a Walgreens, or one of your other mom and pop pharmacies? But I think you really answered the question. And to me, it's the combination of the pharmaceutical services that are like kind of typical, but then also an emphasis on preventative care. Is that
Exactly.
right?
Yeah, and that's one of the things we noticed. So we actually got our start back with our business started in 2018.
Oh.
So both of us had come from the community pharmacy scene, behind the counter, dispensing
White
prescriptions.
coats, all
Yeah,
that
the whole
kinda jazz.
thing,
Okay.
white coat. And just being in that scene, we noticed that there was a gap in care. So we would have people come in, for instance, with a new prescription for diabetes. And, we go over and ask, do you have any questions? What was your A1C the last time you were in your doctor's office? And they're looking at you like you're speaking a different language.
Right.
And so we're like, okay, you've been diagnosed with diabetes. This is your second or third diabetes medication. Why don't you know what an A1C is? And so Dr. Jennifer and I have known each other over 20 years. And we talk periodically, and we're like, you know what? There's a gap in care. There's a need for more comprehensive, personalized care. And we're not providing it behind the counter, dispensing prescriptions as fast as we can. And so that's where the consulting came from. We were like, we want to be that bridge between the patient and their healthcare provider so that we can improve outcomes. Because Alabama is a state where our incidence of diabetes is like 14%. And most of those are not controlled.
And is that high? Like,
That
put
is
that
high.
into
It's
perspective.
one of the it's
Okay.
one of the highest in the United States. I mean,
wow.
if it weren't for Mississippi, we'd probably be at the bottom.
Oh, it's one of those metrics.
It's
one of
right,
those
where we're
metrics.
high on a list that we don't want to be
And
high
that
on.
we don't want to
Okay,
be on.
okay.
Exactly. So we decided, you know what? There's a way as pharmacists, as educators, as consultants, we can come in and bridge that gap. We can educate patients. We can work with providers to help improve outcomes. Because let's face it, doctors are busy too. I mean, they're seeing as many patients as they can to make ends meet so that they can, pay for their staff, pay their salaries. So they don't have a lot of time too. So we're thinking, how can we formulate a company that can go out and provide this personalized care to these patients? That's where MedsPLUS Consulting was born, out of just our desire to bridge that gap. Then when the pandemic hit, we were asked to go out and help with vaccine distribution.
Got it.
So
okay.
at that point, so during the 2018 to 2021 time, we were working our full-time jobs, working the business on the side, establishing partnerships, relationships, and the like. So in 2021, when the pandemic hit, the vaccines came available. We were asked to, can y'all help us get vaccines out into vulnerable communities? And we were like, absolutely. So I called Jennifer. I think you were at work that day. And I was like, hey, this is our chance. We can actually make this happen. Let's do this. So 2021, we left our full-time jobs, started the consulting business. In 2022, we actually opened the pharmacy. And here we are in 2025.
Okay, so I got so many
I know,
questions.
I know.
Okay, but
So
this
now-
is so great. Okay, so you do have a brick and mortar,
We do.
which is downtown Birmingham.
Well, when you say brick and mortar, we do. It's an office suite in an office building.
Okay.
So we don't have a standalone building with our name on it.
And we don't have a traditional drugstore.
Right.
So you walk in,
okay.
you won't walk past the cigarette counter or the bread and milk.
Phew.
Yeah,
Right.
Yeah. No,
'Cause,
I know.
it's a little odd.
It
when,
is a little odd
when
when the
pharmacies
healthcare provider
yep.
sells,
cigarettes and alcohol and all
Mm-hmm.
the things. Yes, continue.
Yes. So it's not a traditional drugstore. It's the pharmacy clinic. So when you walk in, you are a patient in our clinic, and we serve you as such.
It's like a doctor's office, kind of,
Exactly.
where you walk in, you've got a receptionist or whatever.
Exactly.
Okay,
We have
okay,
a
okay.
lobby. And you can come in and pick up your prescriptions, or you can come in and have a consultation
To
with
actually
one of us.
talk to a pharmacist
Yes.
and say,
Exactly.
this medicine isn't doing what we thought it would do, or my dreams are really weird, or
Yes.
maybe it's messing with one of my other medications, or okay.
Exactly.
Okay.
Exactly.
We get it.
And for those, we actually prefer appointments because we
Yeah,
want to
sure.
dedicate that time to you.
Right.
Both of us working behind the counter. I remember vividly working behind the counter at a moderately busy pharmacy. It wasn't as busy as some of our others, but I would have patients come up to the consultation window. And in the back of my mind, I'm thinking, dear Lord,
Right.
if I step away to answer their question, I'm going to be 15, 20 minutes behind because we were measured based on metrics. How
Yes.
fast can you do this? How many phone calls? Answer your phone by the third
Most
ring.
people don't realize that.
Yeah, they
They
don't.
don't.
They
don't.
think that pharmacists really are making the medicine and, like, right. And like
Right.
making the vials
Yeah,
of
no.
the, like maybe 80 years ago,
Right.
50 years ago, but that's not how it works now.
That's not how it works. And unfortunately, because, people who know that we don't do that anymore, they think that it's almost fast food like, which is also not. So it's not the compounding, making the medications, that type of thing, but it's also not building cheeseburgers.
Completely. Yes.
We've had that, like, all you're doing is putting pills from the big bottle into the little bottle. Why is it taking so long? Well, we're also making sure your doctor's not trying to kill you. No offense to doctors. We're also making sure this isn't interacting with something else that you're taking, whether it's we know about it or it's something you're taking that nobody knows about, which has
Totally.
happened. And we're also checking to make sure that this is the appropriate dose for your condition, which sometimes we have to kind of guess until you get there because we don't have records from the doctor. So there's a lot that's going on behind the pharmacy counter that patients are completely unaware
And sometimes
of.
talking to insurance companies.
Most of the time, talking to insurance
Is
companies.
that how y'all are funded? Or like, how do you get paid? Is it through insurance companies? Is it through employers, through your consulting? Is it both? How does that work?
Good question.
Thank you.
Question.
Thank you.
So typically when we are talking about the pharmacy, then yes, we rely heavily on insurance reimbursement.
Okay.
When a patient comes to
Through
pick
like
up
here, like Blue Cross Blue Shield,
Exactly.
Medicaid,
Humana.
all of those.
All of
Okay,
those.
all of those kinds of things.
Absolutely. And typically when you come to the pharmacy, you have what's called a copay or coinsurance that you pay out of pocket. People have no idea what the cost of medications are. Most recently, they were made aware when the Wegovy and the Mounjaros of the world became available and accessible,
Right.
to where some people were willing to pay out of pocket when the insurance didn't cover.
Right.
So a month's supply could run you easily $1,200 cash. For your common medications, such as generic medications for blood pressure, diabetes, in the pill form, not as much. So what happens is we receive a prescription, we enter the prescription, we have the patient's insurance, then you have a middleman, which is called a PBM or pharmacy benefit manager. So our pharmacy computer talks to the PBM. The PBM is like, okay, that's her, that's the right birth date, that's the right plan. Okay, they need to pay $35 for that. Oh, wait, they need a 90-day supply. We're going to kick that 30-day supply back. So we do have some things we have to maneuver through.
Yep.
And then when that price kicks back, it prints out on the label. When the patient comes to pick up, they pay $35. The part that the general public is not aware of is the fact that we had to order the medication. So that means we're set up with a wholesaler who has all of the big bottles in their warehouse that we order from on whether it's a daily or weekly basis. They have a cost. They're delivered to the pharmacy. Now we have to unpack, check it in, update our inventory, take the prescription, type it in, count it out. And we have technicians that do that, very great at their job, but they like to get paid as well.
Of course. Right. These are all things called overhead.
Called overhead, COG or COGS, cost of goods, cost of doing business. Not only that, of course, the supplies. So we have to print the label, we have to give patient information, we have to put it in those bottles, whether we're pouring or counting. So all of those things come into play as far as the cost of doing business. So if we're purchasing a medication, and we'll make it simple math, for a month's supply, our cost is $50. But you're getting, no, let me do a bottle of 100. The cost is $50, and you're getting a portion of that. Your cost is $35, but our cost is, say, $100. And then the insurance may pay us $15. So 35 plus 15 is not going to cover the cost of, it doesn't equal plus the other things that are involved. So that's the state of pharmacy right now.
Yeah.
So to answer your question, in the pharmacy, we rely heavily on insurance because most people have to have insurance to even see the doctor to even receive the prescription for the prescription medication.
Right.
So for those that do not have insurance, we do participate with the Mark Cuban Cost Plus, and it's helped a lot of people out tremendously
Like
with the
Shark
cost.
Tank, Mark Cuban.
Yes.
That Mark Cuban.
Okay.
Dallas
Yeah, we're one-
Mavericks Mark Cuban.
We're one of the few in Birmingham actually that actually are a part of that program.
Cool.
So we're glad that we're able to offer a cost alternative to people that do not have insurance.
Right.
So when we look at our consulting, then of course we're taking those factors into consideration, whatever service that we're providing, the time for it, et cetera. So it's a different model. But yes, we do have an upcharge for that as well because we have to buy supplies
Of course.
for the test, the staff to be there to do that as well. But
Right.
it's, if you've noticed there, well, you may not, you said you've been here a year.
A little over a year. Yeah.
Okay. But yeah, in some of our, throughout the city of Birmingham, the greater Birmingham area, we've had some of the major chains close their stores.
I have heard about that. Yes.
Pharmacy reimbursement is really, really tight. And then our seniors are the fastest growing segment of the population.
Absolutely.
So for commercial payers or people that are employed, a lot of times you'll get a copay. Very rarely is everything zero cost for the patient. For a lot of our seniors, a lot of their plans are zero copay
Because of Medicare.
because of
Or
Medicare.
whatever.
That type of
supplement
plan that they have.
Right.
Yes. So now on top of those pressures with reimbursement, you know, that kind of piles on to it as well. So there's a lot of pressures that are out there. But for the pharmacy, the insurance is the primary payer.
So I assume that your primary population are seniors, or who, like, how would I find out about you all? Is it mostly like folk, because you started doing like vaccinations and you said in some vulnerable parts of Birmingham, are you still seeing clients come from those areas, or like who's a typical customer of yours?
Yeah, a typical customer is someone we meet in the community. So Jennifer and I are very involved in community events in and around Birmingham. Even from the beginning, back in 2021, we are very boots on the ground, showing up at health fairs, at churches, community centers, senior centers. And so when we're there performing a service, i.e. a vaccine clinic, then of course we promote our pharmacy.
Sure.
So, what pharmacy do you use? How do you get your meds? Because a lot of people in senior centers, don't have transportation.
Right, exactly.
So how do you get your meds? Does someone deliver to you? And then we also know with seniors, many of them are on multiple medications.
Absolutely.
Anywhere from 8 to 12 different drugs. And because of that, they run the risk of not being adherent to that regimen because it's so complicated. I take one pill 3 times a day and then one in the morning and one at night, and it just becomes confusing and overwhelming. So we developed our MedsPLUS blister pack, which is actually a comprehensive personalized pack that is dosed for the patient.
Oh,
so
I
on Monday
love
morning,
this.
I open up my blister and all of my morning meds
So
are there.
you don't have to have one of those things
Right,
anymore where you're
yeah.
putting your own stuff in and you're
Yep.
like, did I take this?
Exactly.
Or your kids are trying to figure
Yes,
out,
yes.
Mom, you haven't taken your, it's just
Exactly.
all together.
So
Oh,
we tell
that's
people we're giving you
genius.
your Sunday afternoon back because a lot of people do this on Sunday afternoon. Either
Yeah.
they'll do it or their child will do it. And we're like, we're giving you your Sunday afternoon back. We will package it for you the way it's supposed to be taken. And that way you're able to see Monday morning, did I take it? If Monday morning is gone, that means you've taken it. And it's also convenient because it's a blister, so you can actually tear the pack off. So if you're going to lunch with friends or, to
Right.
dinner, you just tear that pack off, put it in your purse, and after you've eaten your meal, you take your pack
That's
and your
pretty
afternoon.
genius, y'all.
A lot of my mom is actually on the blister pack, and she absolutely loves it because she has some mobility issues and she has some dexterity issues, and it just makes it easy for her. She just pops it off, opens it up, boom, she's done, and doesn't have to worry about the weekly, pill reminder.
So I know I'm not asking for your professional opinion about this, but feel free to give it if you want to. But I know seniors are one of the faster growing segments of the population who are experimenting with medical marijuana or other products and things like that. And sometimes that can lead to all kinds of interesting things happening, right? So I'm wondering, when one of your customers or your clients, when they come and they do want to talk to you and you are asking them, like, what's going on? Do you understand why this is being prescribed for you? Like, how honest do they get? Do they really talk to you about their drinking? Do they talk to you about maybe if they are using marijuana? Like, and how much do you inquire about that?
That's a yes and a no question.
Right.
I'm going to give you a yes. Funny story.
Okay, I love it.
We have one patient.
And I know exactly who she's talking about. That's the funny part.
And I'm going to call him Uncle X.
Okay.
So typically, when he needs his prescription, we'll call him and let him know the delivery fee. So when I have delivered to him in the past, I would call. He's not in his apartment. And he'll tell me where he is. So I have to get in my car, go around the block, and he'll wave me down. He's out on the corner with his friends.
Okay. You're painting a great picture here. I got it.
Male and female.
Oh, uh-huh.
Have their own little chairs set up. You got it. So when I ask him for the money, it's like, come on, doc, now. You can't take my last. Like, what do you mean? He's like, I had to get me a little something. I couldn't come over here empty-handed. So he had his pint.
Uh-huh.
And then as I'm walking back to the car, I said, Doc, you got some weed on you? I said, No, I do not.
Fresh out. Right. Sorry, Uncle.
So yeah, I call them that. So we'll have interns, we'll have students. We precept pharmacy students from Sanford Pharmacy School.
Got it. Okay.
So when they have to encounter, we call us, oh, that's just Uncle so-and-so. He is who he is, and we allow him to be who he is. I will say, so in that scenario, yes, I know what he does. I know why his gout acts up.
Yeah.
Because number one, I've been to his apartment, seen the lack of nutrition around, things like that, and what he's eating and drinking. So the other part, I think, is where people may not feel comfortable sharing.
Absolutely.
But sometimes if you ask questions in a non-judgmental way, you can get to what you may suspect. Because if you're checking off all of these boxes and something's still not quite right, then that's going to lead me down another path. And I think that that's common even if they're not doing something illicit.
1,000,000%. Yeah. I mean, it's like when you go to a pediatrician's office and they go down the list and they're like, do you wear your seatbelt? Yes. Do you smoke? No. They're not even like looking up but that's not their fault necessarily. It's the system in which they're working. Absolutely. And it's how they pay not just themselves, but their staff, keeping the lights on, and they've got to ask those questions. And if you're not looking up to see, is there like, did they have a weird glance when you're asking them how many
body
times?
language?
Right, exactly. And you don't even have the time to actually have the conversation.
Absolutely.
And that goes,
sometimes when you ask the question, then you got to be ready for the answer.
That's true.
Exactly.
And see, pharmacists, that's another thing people don't understand. Not only do we have all of these years with the medication, pharmacology, pharmacodynamics, we're taught how to counsel patients. We're taught how to ask those questions so that they're not yes and no questions, but where they actually have to answer and give us information. Yes. So how many packs a day do you really smoke?
Like for real.
Yeah.
Right, exactly.
And that's one of the things too, I feel like Jennifer and I have a great rapport with patients, especially in the communities we serve, because even back during the vaccine time, our community, and by that I mean the African-American community, was very hesitant to receive the vaccines. They had a lot of vaccine hesitancy. And we kind of approached them as your sister, your auntie, some of them your mom. And it was more out of love. Like, we want to give you this information. This is what we know now. This is where we're headed. This is what we're seeing as far as, complications from COVID. And so it was the way we approached people. And we take that same approach with patients that we serve. We're not here to bash you. We're not here to make you feel bad. We want to help you. And by fostering that relationship, it's they're more likely to tell us things that they may not tell the pharmacist in Walgreens.
Totally. I mean, we've had multiple conversations on this podcast about the power of peers. And it's not just people who have the same lived experience that you have, but it's the people that look like you, that sound like you, that can, empathize with, a situation you've been in, whatever that looks like. It's a teenager talking to another teen. It's just, it's a power of peers that builds trust and makes people more comfortable in sharing about fill in the blank topic, right?
Yeah, because it's even body language. Like, we've, sat across from people having consultations, and you ask a question, and it's just like, I understand what that means. Someone else may not. But, even body language and expressions that you can say, one of the things you were talking about with the pediatrician, I have a 6-year-old or 7-year-old son now. And when we go to his doctor's visits, it's like, is he eating fruits and vegetables? And I'm like, yeah, and she looks at me and she knows exactly that he eats chicken nuggets and oatmeal most of the time.
Right. Yeah.
So that's the kind of thing I'm like,
he's getting his
calcium
from mac and cheese.
Exactly.
Right?
Exactly.
Right.
And the milk that's in the oatmeal. So, just things like that I feel like we have a very good relationship with the people that we serve, and it opens the way to more effective communication, and we can assist them in better ways.
Are there a lot of Black female pharmacists? I can't imagine, but I don't know. Maybe that's changing.
I would say more than Black male.
Oh, okay.
Because even the time when I was in pharmacy school, it was very few Black male, and I graduated in 2000.
Okay.
And what would you say about the mix? I still feel like there's more female.
Yeah, there's definitely more female. And I think the last time I looked at stats, it was somewhere around 6% of pharmacists are African American.
Oh my!
Yeah, which is
So
very,
very
low.
Small.
Yeah, and physicians is even lower than that. I think they're around the 3 to 5% mark.
Really?
Yeah. So and we see it in the community all the time. We'll be out at an event, and people will say, "Well, how can I make an appointment with you?" Thinking we're physicians because we have Dr. Jennifer, Dr. Pauline.
Yes.
And we're like, "Well, we're actually pharmacists." But, we do try to connect people with providers who look like them and who understand their lived experiences. But, it's really hard because as soon as we find a doctor that we connect people to, it's like within a month, their patient panel is closed. They're not accepting any new patients. And we're fighting to find another,
I moved here, right? I have had the hardest time finding a physician here that is accepting new clients, that doesn't kind of creep me out, that isn't trying to upsell me on all the latest things. It's been really hard. And that's not just a Birmingham thing. That's just a fact. And I think once you find somebody that makes you feel comfortable, I cried when I left my gynecologist in St. Louis. I was like, I'm so sad to be leaving because I just loved her so much and she got me, And so it made me really sad to have to switch. So when you find somebody that makes you feel comfortable and that gets you and that is willing to come out from behind the counter. Yes. Okay, but I got to really ask this question. What's it like working you two together? Like two strong women? Because
well, you know what? I think that's a very excellent question. You're probably one of the first that has asked us that because when people see us and they're around us, then they can catch the vibe.
Yeah.
You know what I mean?
Right.
So Pauline is reserved, very professional, very buttoned up. Jennifer, it depends on the day, the time, and hour.
So y'all are like a perfect yin and
blend
yang here.
Yes, we are.
Okay.
Yes, we
okay.
are. As a matter of fact, one of our spiritual counselors calls us Blaze and Breeze. And I think you can guess who is who.
Well, give you an example. This morning, was assisting a patient with their Amazon order for medication.
Okay.
And talking with the rep, it was emotionless, heartless, cruel. And I said, no, not today. No, not today. I said, I'm sorry you feel that it's okay that I don't have my life-saving medication. But can you show some compassion
Please.
on the keystrokes?
Oh, you were in the chat. It was a chat.
You can't talk to them. It was in the chat.
Wow. And of course, MedsPLUS Pharmacy, it's all about compassion and care.
Absolutely.
Of
And I was
course.
doing that on behalf of my
I
patient
understand.
because they hadn't received their medication.
I understand.
And we, stepped in to assist and everything. But it's things like that. And, sometimes I can be misunderstood, but it's from care and compassion.
And you all have that balance. I mean, the way you told the story, you reached out to Dr. Jennifer. So you knew what you were getting into.
Yes.
Right?
Yes.
And so
we've known each other 24 years
right.
now.
I mean,
so.
that's so has your friendship gotten stronger? Because I'll tell you, it makes me nervous to go into business with one of my friends. My friends and I, we've talked about it before. We've talked about it. We're like, okay, we should go into some consulting, and maybe we'll do that someday when we retire. But I'm nervous that it would damage our friendship.
Well, I would say that over time, okay, so let me tell the story. So in 2001, I was a pharmacy manager at a retail chain.
Okay.
And Pauline had just been accepted into pharmacy school, and she said, well, I might as well get a pharmacy job. So she came in. She was I hired her as my first intern. So we've known each other from that point forward.
Amazing.
So always kept in touch, et cetera. So when you know somebody, you
Yes.
know somebody. So one thing I knew about Pauline, I knew about her ethics, her morals, her upbringing, because I took care of her mom, her family. And one thing that I knew for sure, she was tried and true.
Yep.
Now, when you do work together, you have to learn each other's quirks.
Totally.
So that was the only learning curve that I see, was learning each other's quirks. So then when I feel like she needed to take the lead, then I fall back, and so on and so forth. So that's what you have to be, is you have to be pliable and bendable, and you can't be me all the time.
Right.
It's a, give and take, if you will.
And I mean, and the best part about that is I am an extreme introvert. I have become more extroverted just being an entrepreneur, because you have to be.
You have to.
But if it were me, I would be in the office or in my home office, writing process and procedures, behind the scenes, building programs and things like that.
I knew I liked you.
Yeah, I would not be out networking and talking, because I don't remember people's name, their faces. A guy I met yesterday, he was like, I met you at the grand opening, blah, blah, blah. And I'm like, I have no idea who you are.
Right.
But Jennifer never meets a stranger. As a matter of fact, when we first started attending networking events together, I would just follow her around. Like, literally, she would go out and be talking to people that she's never met. Oh, what do you do? Who are you? What do you? And I'm just like, and if they said something, I try to jump in the conversation. And now I'm more, I've adapted, I've learned, I've grown. But yeah, but when we first started, I would just follow her around the networking events. And
I
Now
would
me-
have never known that if you hadn't said that.
yeah.
Well, the counter that, I would rather not be writing policies and procedures. Just do it this way. The way I do
The
it
way
works, so
mine
just
works.
do it.
Right.
But then, yes, she has taught me that, she's like, we can't build and scale our business like that.
Right.
So that's where I would say my growth has come in, as far as learning. I got to slow down, take a step back.
Amazing.
And learn processes, and then writing SOPs.
Oh, I love a good SOP.
Yes. Because she'll come to me.
That's a
"Pauline,"
standard
I mean,
operating procedure for those people
There
who
you
don't
go.
know.
But she'll come, Pauline, we can do blah, 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 da, 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 da. And I said, send me a proposal.
And guess what? She never gets it.
Send me a proposal. Let's get this going.
So
I'm that person.
you're painting a vivid picture, Dr. Jennifer. I commiserate, Dr. Pauline. So if somebody wants to find you all, somebody's listening to this and they're like, okay, my dad needs a different type of pharmacy experience. I really, I want to make a change. Like, how do they find you?
Absolutely. So one of the things that we are very active on is social media.
Oh, okay.
So every Monday we do a MedsPLUS Medical Minute Live at 1 o'clock.
That's not you. Is that you?
No, I'm there.
Oh, you're there. Okay.
Uh-huh.
Okay.
Now that's where you got it wrong.
Oh,
She can do the camera and she can do all of that.
Okay.
And the posting.
Okay.
Me, I rather face-to-face live.
Okay.
Human to human. That's me.
Got it. Okay. So on Mondays at 1.
We have on Facebook and on our YouTube page, MedsPLUS Medical Minute, where we share health information.
Okay.
So we are active on all the social medias. MedsPLUS Consulting is how you can find us. We also have where you can call us, and that number is 205-650-4636. You give us a call, we'll ask you a few questions, and then we take it from there.
And that's as far as transferring prescriptions to our pharmacy.
To our pharmacy. So one of the things with that, we always want to make sure that we contact the doctor's office on behalf of the patient, let them know that you've changed pharmacies,
Right.
so that on down the line, when it's time for new scripts to be sent in, they get to the right place and on time. We always want to make sure we have a record of all of your doctors, not just your primary, who are your specialists that you're seeing as well.
Got it.
So that we can stay in contact. So then if we see something that's going on and we have questions, we already know who to contact. We also want to make sure whether it's a family member or if it's like you were saying about the dad, so, okay, what's the situation? Is the daughter calling? Okay, so tell me about your dad. So then we already know that this person needs help. So
Right.
then, of course, we'll offer the blister pack for convenience, whether it's, 1, 2, 3, 10 medications. A lot of times, some people, they're like unsure about the blister pack, but at every opportunity that I can, I'm always, you sure you don't want the blister pack?
Gosh,
You wouldn't have to call us. We'll call you. Everything's synced together. You're not getting text messages and phone calls that say you need to refill, you need to pick up, you need to refill. You have everything you need at one time. So, they just give us a call, or if they want to email, info at medsplusconsulting.com.
I love your emphasis on prevention. I mean, I'm a prevention nerd. I love that. I love that people can actually have a conversation with you and you can ask some open-ended questions to find out about what's really going on. I will not say their name, but a close older gentleman to me just stopped taking his meds.
Yeah.
And it's because he was really sad.
Yeah.
And, it took him getting admitted into the hospital because his congestive heart failure started acting up because he wasn't taking his meds. Why aren't you taking your meds? Well, I'm depressed. I don't feel like it's worth. I mean, those are the kinds of things. I'm not saying that a pharmacist could be the one to find out, but why not?
Yes.
It's more common than you think.
I would bet.
Okay.
I've been doing this for a long time.
Okay.
And I think it's very common,
It
which
is.
is why when Ronnie's like, their approach to pharmacy is different, I'm like, hallelujah, let's get them on the show.
Yeah.
Because
In our diabetes class, one of our current ones, there was a patient that just spilled it all out. But it's like it's a support group for her. And she talked about the time she got depressed and just stopped taking her medicine because I was questioning how long had she, had the diagnoses. She was on insulin. She seemed fairly young. And then she told me that part of the story and how she had to be hospitalized and they just had to start all over again. And, I can kind of tell by her mobility and how she talks that there was probably a little slight stroke in there. And people don't understand how serious it is once you've had a diagnosis and then you make the decision to stop your medication.
Oh, absolutely. Oh,
now
my
we're
gosh.
talking the worst case scenario, which is death, or the next worst, which is quality of life.
Absolutely.
Where all you had to do was swallow the pills. Now you may have to have a cane, talk differently,
totally.
memory off, or other things, but it happens a lot.
And people are more inclined to open up to someone who looks like them, sounds like them. And I'm not talking just about skin color. I'm talking about gender. I'm talking about accent. I'm talking about, lived experience. So,
And that's the difference, I think, with MedsPLUS compared to other pharmacies is, pharmacy has become so transactional where, it's literally, I drop my prescription off or my doctor sends it in and then I log in or they send me a text message and then I go to pick up. Hope it's there. A technician
Hope it's there.
Yeah,
right.
hope it's there and ready. A technician will check me out at the register and pray that I don't ask a question because that'll bring the pharmacist over. It's so transactional. And that's one of the reasons why I left my position after 21 years.
Wow.
Because that's not why I became a pharmacist. And so at MedsPLUS, we want it to be comprehensive. We want it to be relational. We want it to be personable so that you can ask that question that you may not have asked standing in line with 5 other people behind you that you may be
breathing
embarrassed
down
about.
your neck.
Exactly.
Right.
Exactly. And because you have a question, your transaction is taking longer. So that means I have to stand in this line longer. Like we wanted to get away with that particular model. And that's why we have the appointment-based model. We have virtual consultations, where we can talk to you in your home. You don't have to leave your home. We'll deliver your medication to you. And then we'll set up a virtual consultation with you to talk about the medication so you can ask the questions that you really need to ask. So, yeah, we wanted to do away with the transaction of pharmacy.
Well, we're going to leave it there because that's just the best summation that I've heard. I love it. Thank you both for being here, seriously. And thank you, Ronnie, for telling me what to do again. If you like what you heard, and I know you did, please consider rating, reviewing, and subscribing to The Shield. Thank you.